Good day. I'm Albina Garcia presenting to you my study on nurses' spiritual well-being and extent of practice of spiritual care together with my co-author Dr. Maria Cecilia Martinez. For the abstract of the study, this descriptive correlational study aimed to determine the level of awareness towards spiritual well-being and the extent of practice of spiritual care of nurses who care for non-COVID and COVID-19 infected adults or adult patients at the tertiary hospital in Metro Manila. Data were gathered using two standardized questionnaires, namely the Spiritual Well-Being Scale or SWBS, created in 1982 by Craig W. Ellison and Raymond F. Palautian, and the Nurses Spiritual Care Therapeutic Scale or NSCTS by Mamier and Taylor in 2015. Weighted mean and Spearman's rho were used for the statistical treatment. Results of the study showed that the nurse respondents have a very high level of awareness towards spiritual well-being as to religious well-being, or RWB, and the existential well-being, or EWB. They have a moderate extent of the practice in terms of spiritual care. There is a moderate significant relationship between the nurse's level of awareness towards spiritual well-being in terms of religious well-being, existential well-being, overall spiritual well-being, and their extent of practice of spiritual care. This implied that there is a relationship between the two variables accordingly, but not to the highest degree. That is the very high level of awareness towards spiritual well-being of nurses just moderately affected their extent of practice of spiritual care. Therefore, the researcher recommended more provision of spiritual care for the nurses for their patients. As an introduction, during the COVID-19 pandemic, healthcare workers, especially nurses in all parts of the world, have been overwhelmed as they work as the frontliner to help the patients infected by COVID-19 by Altobaiti and Ashimari 2020. Nurses risk their lives to save people who have COVID-19, people who present severe distress associated with the disease that affects different aspects of their wholeness, including physical, emotional, mental, social, and spiritual components by Tembu 2017. They still assume critical functions as they provide holistic care, which is the physical, psychological, social, and spiritual for all these patients by Albaiti et al. 2019. However, the consequences of the COVID-19 pandemic had a major impact on everyone's activities, routines, livelihood, mental health, and well-being by the World Health Organization 2020. Nurses sometimes forget to include spiritual care as they are tired of fulfilling the physical, psychological, and even social needs of the patients. The researcher, as a nurse and as a catechist herself, wondered why such a thing happened, as she, as a nurse herself, loved to provide spiritual care to her patients. It was one of the researcher's best attributes, offering prayers or praying with the patient and staying at the patient's bedside for a time, especially when the patient needs company and having difficult times are some of her best qualities. Explicit communication, compassion, active listening, and support for the patient make her and her patient feel special. However, during the COVID-19 pandemic, the researcher noticed that nurses' time of care lessened as they admitted more infected patients and become assigned to the COVID-19 positive areas or wards. The researcher has observed that nurses can still provide physical, psychological, and social care to patients even with increasing admission, but not spiritual care. It was always left behind, as nurse would say, they will do it after finishing all their tasks in the area, but too tired to perform when the time comes. Some of the researchers' co-workers even verbalized that they were afraid to approach the patient and ask about their religion, their spiritual needs, or offer prayer or any spiritual emblem. They feel embarrassed to ask and to be recognized as discriminatory, so they just simply question their patient as to what they would want their nurses to do for them. In some situations, some nurses also express that most of the patients seek to improve their physical health problems and do not pay much attention to their religious needs or ask for help in this regard. As a result, these nurses do not care about it. Similar to these observations are the study of Abbasi et al. In 2016 and Gardide et al. In 2015, which showed that spiritual care is not well provided and that the religious needs of the patient are not appropriately met. These conditions motivated the researcher to pursue this study. She wanted to identify the challenges of nurses in rendering spiritual care, as well as determine their level of awareness about spiritual well being and their extent of practice of spiritual care. As for the methodology, this study utilized the descriptive correlational design to determine the level of awareness towards spiritual well being and the extent of practice of spiritual care of nurses who care for non COVID and COVID 19 infected adult patients at a tertiary hospital in Metro Manila. Data were gathered using two standardized questionnaires, namely the Spiritual Well-Being Scale or SWBS, created in 1982 by Craig W. Ellison and Raymond F. Palautzgen, and the Nurse Spiritual Care Therapeutic Scale or NSCTS by Mamier and Taylor in 2015. Weighted mean and Spearman's Rho were used for the statistical treatment. Ethical and legal aspects were considered during the data collection. For the result and discussions, it's my co-author, Dr. Maria Cecilia Martinez, will discuss it.
So for the results and discussion, Table 1 shows the nurse's level of awareness towards spiritual well-being as to religious well-being, with 5.31 as its overall mean score, interpreted as a very high level of awareness. Highest item from the table is number 3, about nurses believing that God loves them and cares about them, with a mean score of 5.71, interpreted as a very high level of awareness. The lowest item is number 6, about nurses feeling unsettled about their future, with 4.74 as its mean score, interpreted also as a very high level of awareness. So the findings of an overall very high level of awareness in Table 1 implies that the nurse respondents were greatly aware and were found to have greater strength and comfort in their faith, feeling more at peace, more productive, and more purposeful, and derive more comfort and strength from their faith, that they believed that they would be fine despite the tremendous consequences of the COVID-19 pandemic, which rendered major impact on their activities, routines, livelihoods, mental health, and as well as well-being. So this also means that they find greater satisfaction from their faith by being religiously well while doing or saying their personal prayer, or knowing that they have a great relationship with the higher being, which is God. For Table 2. So Table 2 is about the existential well-being. So it displays the nurse's level of awareness towards spiritual well-being as to the existential well-being, with 5.28 as its overall mean score, interpreted as a very high level of awareness. So the highest item is number 3, about nurses not having personally satisfying relationship with God, with a mean score of 5.56, interpreted as a very high level of awareness. So the lowest item is number 6, about nurses feeling that life is full of conflict and unhappiness, with 4.90 as its mean score, interpreted also as a very high level of awareness. So the finding of a very high level of awareness towards existential well-being in Table 2 depicts that nurse respondents were greatly aware of maintaining a strong sense that life is meaningful and worth living. And indeed, they have to grow or mature from these experiences despite the presence of constraints and difficulties, especially at work. So this happens because people, like the nurses, when faced with a significant threat to life or like the pandemic, tend to reflect more intensely upon existential issues, such as the meaning and purpose of one's life. So these nurses realized that they were present or became nurses to become instruments of the hospital to serve patients and their families affected, infected by the pandemic, that they have to be strong to fight amidst the hardships of being a frontline nurse to be able to help the patients. Table 3. So Table 3 illustrates the nurse's extent of practice in terms of spiritual care, with 2.92 as its overall mean score, interpreted as the moderate extent of practice. So the highest item is number 3, about nurses listening actively to patient stories of illness with a mean score of 4.09, interpreted as a high extent of practice. So the lowest item is number 11, about nurses arranging for patients, clergy, and spiritual mentor to visit, with 2.13 as its main score, interpreted as a low extent of practice. So the moderate extent of practice in rendering spiritual care to patients implies that the nurse respondents were able to provide their patients spiritual care. However, there are times that they cannot simply do it. So this can be traced from the fact that these nurses are filled with tasks that overwhelms them, especially now that the world is suffering from COVID-19 pandemic. So the role is now and has been always concentrated on giving physical and psychosocial care that is directly related to the treatment of the illness or health problems of their patients. So these situations made the nurses become constraints in terms of their ability to deliver spiritual care. They were tasked to focus more on the care, like physical and psychological and social impact, for the affected patients and their families due to consequences of the pandemic. Table 4 now presents the relationship between the nurse's level of awareness towards spiritual well-being and their extent of practice of spiritual care. The findings of a positive, moderate, significant relationship between spiritual well-being in terms of RWB or EWB and the whole SWB and their extent of practice of spiritual care means that even with a very high level of awareness towards spiritual well-being, these nurses cannot achieve a very high extent of practice, only to a moderate extent. This is due to the fact that the nurse respondents of this study have encountered challenges in rendering spiritual care, the reason for the moderate extent of the practice. So the top 3 among them are nurses lacking time to provide spiritual care, 2. Nurses having anxiety about providing appropriate, non-discriminatory spiritual care, 3. Nurses lacking clear guidelines for their role in providing spiritual care and lacking training and education on spirituality for pre and post registration nurses, respectively. So this finding negates the results of the study of Asanza et al. In 2015, which revealed that spiritual care competence had a positive relationship with spiritual well-being and spiritual care perspective, or the significant relationship observed between spiritual faith and spiritual care found by the study of Zari and Jahande in 2014. For Table 5 presents the challenges encountered by the nurse respondents in rendering spiritual care to their patients. Data shows that item 4 about nurses lacking time to provide spiritual care ranked first or top 1 with 53 out of 77 responses. Item 2 about nurses having anxiety about providing appropriate non-discriminatory spiritual care ranked second or top 2 with 48 out of 77 responses. Item 3 and 5 about nurses lacking clear guidelines for their role in providing spiritual care and lacking training and education on spirituality for pre and post registration nurses, respectively, ranked next, top 3.5, and which is 44 out of 77 responses. For the conclusion, so the researcher concluded that the nurse responded of a very high level of awareness towards spiritual well-being as to religious well-being and existential well-being. They have a moderate extent of practice in terms of spiritual care that the null hypothesis was rejected. So there's a significant moderate relationship between the nurse's level of awareness towards spiritual well-being in terms of the religious well-being or RWB, existential well-being, EWB, and the overall spiritual well-being and their extent of practice of spiritual care. So this implied that there is a relationship between the two variables accordingly, but not to the highest degree. That is the very high level of awareness towards spiritual well-being or sense of well-being from spiritual attitudes and striving of nurses just moderately affected the extent of practice of spiritual care, especially if there are barriers and hindrances like time constraints, anxiety, and lack of clear guidance in providing spiritual care. It is therefore important for nurses to always take time to prepare, practice, and provide spiritual care whenever it is needed. It is a vital part of the nurse's role for their patients. For the recommendation, so based on the results of the study, the following recommendations are given. Nurses to enhance their spiritual well-being and manage their practice of spiritual care to their patient by engaging and participating in the implementation of the spiritual care program that was developed based on the results of this study. Hospital administration to spearhead the development and implementation of the spiritual care program in their institution that was developed based on the result of this study. So this is to help increase the awareness of their nurses and make them spiritually well and more capable of rendering spiritual care to their patients holistically. Number 3, patients and their significant others to continue giving importance and support to their nurses as they enhance their spiritual well-being and holistically render spiritual care to their patients. For the nurse education and nursing school to become a bridge in further developing the nursing curriculum in terms of enhancing the spiritual well-being of nurses and how they would render spiritual care for patients. And lastly, number 5, future researchers to use the results of this study as a reference material for future researchers having the same topic. The following are references for our study. Thank you very much.